Good morning, everybody. Kevin Wood back for another edition and segment of Coffee Talk. I think this is a really important one, and it's really real, as everybody knows. In the fifth or sixth week of the COVID-19 pandemic, I have a guest here right inside Mather Hospital in our own Port Jefferson. So hello, Nicole Amendola. Thank you for joining me for
Good
this
morning.
edition of Coffee Talk. Yeah, we'll put the
Good
cups
morning.
up. I know you can't drink it, but
I get
that's how we'll start this off. Thank you so much for joining us. I think to start off, there's so much misinformation. You probably go home each and every night. If you do look at social media, you probably see a lot of misinformation, and lo and behold, you're living this day in and day out. And by the way, I want to commend you, of course, and thank all of the healthcare workers at this time. I've said this before, but I'll say it again because you're here with me. Thank you for what you do. You truly are on the front lines. Thank you so much.
Thank you.
I think we have an opportunity to talk to someone like you who is not only local, but living this day by day. And if you had to dispel one piece of disinformation out there compared to reality, what would that be?
I would definitely say that I know there's a lot of people who think this isn't real, driving past emergency rooms and seeing it quiet. But if they could actually walk our halls and see what is going on behind these rooms, it is very real.
And I think that unrealness feeling is exemplified, for example, yesterday when I was down in Port Jefferson. The sun is shining. People are trying to live a normal life, but it's not, and you see it all around you. But what's so perplexing to me about this disease is that some people can skate past, and they do skate past it, and some people die. Why is that?
We really don't know. I have to say that's probably one of the most frustrating things to the medical staff and the nursing staff is there really is no rhyme or reason. We can't understand why the healthy person with no medical history doesn't survive, and yet someone in their 80s could. And why it affects the severity of certain people. And I think that is the most frustrating to us healthcare workers is that there is really no rhyme or reason of why it affects certain people.
What's changed for you? You've been a nurse there for 8 years now, I think.
Yes.
So on a daily routine, describe the change that's happened, particularly to you and your staff.
Specifically, I work on 3 North. We are an intermediate care unit. I have 35 beds. 19 beds are telemetry monitored, cardiac monitored, and my other beds are pretty much a surgical step-down unit. My nurses are all critically care trained, but we see a lot from the surgery line and then people that are too sick to go to the normal floor, but not sick enough to be in the ICU. So a lot of times we have happy endings here. You know, we get to hug our patients goodbye. My nurses, about 3 weeks ago, we decided to turn this into a COVID ICU.
Okay.
So,
describe for those that pass Mather every day. There is a new structure there. It was built on a fly. It seemed very fast. Why was that put there?
Which structure are you speaking of?
Right in front of the emergency room.
The Together We Can?
No, not that so much that, but that outdoor building. It seems like heating is connected and everything else. It's like almost a temporary building outside
A temporary building. It was put there for overflow in case the emergency room needed it.
Okay.
So our unit then converted to a COVID ICU. So it's a very different, my nurses walk in, it's a totally different unit than it was a month ago.
So obviously the idea of protection is paramount. Did you have what you needed from the beginning? I know some hospitals didn't, some did. You are owned by a massive corporation. You would think you would have that. What was the situation there?
We have what we need here. We are reusing, N95s. They're able to get new, when they're not working, we give them new ones. But we have had what we need here.
Good.
We are very fortunate, I must say, proud to be part of the Mather Northwell. They have taken care of their staff.
That's excellent. Good to hear.
Yes.
And I don't think that's always apparent from the outside because of headlines, right?
Correct. Yep.
That's excellent to hear. Can you give me some of the more not so good moments that you've experienced there? Something that might have affected you in a way that say, wow, this is really, really different.
Like I said, we get to say goodbye to our patients. We have bonds with our patients. We get to hug them goodbye. Right now, it's a very different world. Most of our patients are intubated. They're on a ventilator. And we are now bonding with families, crying with them, FaceTiming them to see their loved ones. We're the ones holding their hands until the
Wow.
end. So it's definitely a totally different floor than what it was.
What actually happens to the patient where they need to be intubated? The idea is their lungs are building up, probably like you've never seen before, so fast. It seems within days, right? Maybe less.
No, it's days. It's usually days. We've been seeing, I have to say, usually around the 5 to 7 day mark, people go down very fast. The oxygenation is the issue. Their pulse ox, they have a low saturation number, and it's very immediate. I mean, I've never seen people go down this fast.
That's the difference.
Yeah.
Tell me about your staff and who you work with, and has this brought you closer, and what a typical day is in terms of shift?
Um, I actually have about 100 employees here. It's a very large unit, and I have to say my staff has been amazing. I'm not going to lie, we do cry a lot. Not a lot of happy endings here, but they have been amazing here. And, bringing closure and peace to people's families. Our staffing ratios have been okay. They are definitely manageable with the help. I mean, nursing administration and administration at Mather has been phenomenal. They're very visible. The nursing administration you see in the hallways on any given day, checking up on their staff. We actually had Mr. Dowling, the president of Northwell, come through last week, and he wanted to say thank you to all the staff. It was pretty amazing. Yeah, it really was. It was definitely a highlight and a morale booster.
Wow, that's fantastic. What would you
Yes.
want the typical person out in the public to know going forward? Do you get reports? You're on the front lines there, but do you ever get reports on, obviously you see what the governor says and you see what the CDC says, but from your perspective internally, are you getting reports that things are lightening up? Are we going to see a normal summer? Are we going to see a normal year?
That we really don't get. Nobody really truly knows that answer. We worry. Easter was, 2 weekends ago. We worried about a surge, people getting together. So we're kind of going day by day. It definitely we've seen a slight decrease. But nobody's hopeful just yet. It's too early.
Has there been talk about anything that could be an offshoot from this? Some people say we're entering an era of infectious disease, possibly.
It definitely could be.
Could
be, but yeah, like I said, this is so unknown that we are learning every day something new.
Absolutely. I just did an interview with Rebecca Casse, who's local. She has a group of makers that makes PPE and masks. And as we talked about, some need more than the others. But I believe that it's been a morale booster, just that people are in some way trying to contribute.
I can't tell you, the community here, I mean, it has been amazing. Sending food, sending masks, sending anything people can. It is so heartwarming, and that is what actually lifts the spirits of this staff.
Good to know.
I mean, yeah, it really is tremendous. I cannot believe the outpouring of support from the community.
Do you have any communication with St. Charles, or do you ever compare numbers or what they might be going through?
No.
Or Stony Brook?
No.
Okay, so there's 3 concentric hospitals that are dealing with this. Of course, Stony Brook has that massive tenting situation from the state. So I was just wondering if you're probably so busy dealing with what you're dealing with.
I was going to say, there's not much that we hear, listen, about anybody else.
Right.
Everybody's worrying about their own walls.
I'm quite sure. Well, again, thank you, and thank you for bringing a little perspective to this locally. I think it's important.
It is. It definitely is important. It's definitely a change in practice for us, but I would say the nurses have been amazing.
Excellent. Well, stay safe, and thanks for joining us. And, maybe we'll check back with you in a month, and hopefully things are a lot better.
I would love that, and I hope I don't have a mask on.
Well, thanks for keeping me safe.
You're very welcome. It's been a pleasure.
Pleasure. Take care.